This is the first in the series for the respiratory system: gas exchange, hemoglobin, and oximetry. For the topics, we're going to talk about respiration, ventilation, hemoglobin, hematocrit, and pulse oximetry. And this is an image showing the respiratory tract, the terminal end of the respiratory tract with the alveoli, and all of the actually, these are lymphatics, nerves. These are lymphatics, the nerves, and of course, vessels. What is ventilation? Is it gas exchange or is it actual breathing? Answer is ventilation is actually the act of breathing, moving air inside and out, in and out. So you think of the way you think of ventilation, think of a ventilator. A ventilator is delivering air or combination of air, oxygen, different concentrations of oxygen. But that doesn't necessarily mean that gas exchange is taking place. For instance, if they have terrible lungs. So what is respiration? Is it gas exchange or breathing? The answer is it's gas exchange. And respiration can happen at the alveolar level in the lungs, or it can happen in the body cells. So again, ventilation, air is moving in and out of the airways, and respiration is the actual gas exchange. So there's two types of respiration I mentioned. Pulmonary respiration is the exchange of carbon dioxide and oxygen in the lungs, and cellular respiration are at the level of the body cells. And this is, of course, is the citric acid cycle, the Krebs cycle. And then the pulmonary respiration is the exchange where oxygen is going to the blood, and at the same time, the veins are delivering carbon dioxide for exhalation. What situation will prevent the blood from receiving oxygen? Hiking at high altitudes, losing the number of alveoli, and that's in COPD or chronic obstructive pulmonary disease, or in cases where your alveoli are obstructed, would be like pneumonia. So the answer is all of those things can cause or prevent blood from getting enough oxygen. So this is a depiction of it. If you lose the alveoli, since the alveoli are the only part of the respiratory tract where oxygen and carbon dioxide exchange take place, if you lose your alveoli, you lose your ability for gas exchange. And then, of course, the other situation is low inspired oxygen. If you're hiking at high altitudes, you're just not getting enough oxygen to the blood. So going further in the respiratory tract, the whole point of the respiratory tract actually is getting oxygen to body cells. So what situation will reduce the delivery of oxygen to the body cells? Anemia, which is the medical term for low red blood cell numbers. Abnormal hemoglobin, like sickle cells, or both. And this is an image of a hemoglobin molecule. These are the iron that bind to oxygen, and this is out of the red blood cell. So the answer is both. Both low number of red blood cells and abnormal hemoglobin can reduce the oxygen delivery to the body cells. So transport to the tissues is dependent upon normal hemoglobin, normal red blood cells, and normal numbers of red blood cells. And of course, having oxygen to take it. to go with it. So these are pictures of sickle cells, poorly functioning hemoglobin, and not enough red blood cells in the case of anemia. So let's start how red blood cells begin, starting from stem cells in bone marrow. Prior to ejection from the bone marrow, the red blood cells become kamikaze pilots, where they eject everything. They eject all their organelles, mitochondria, nuclei. They carry only hemoglobin, and it makes them flexible to move through capillaries. However, the bad side is they die after 120 days. Okay, let's go on to blood itself. What is blood? The term, when someone says you've got enough blood, is it your red blood cells, white blood cells, red blood cells, white, red, platelets, red, white, platelets, and plasma? So the term blood refers to everything, all of those things. 55% of the blood is this plasma. And this shows a test tube where it's been centrifuged, or it could even be allowed to settle. And the top part becomes plasma. That's the non-fluid, non-living fluid matrix. And the white cells sit right here in this buffy coat. They don't represent a ton of the percent of what blood is. Red blood cells are 45% in general. And this cell right here is a neutrophil. So blood is all these things. When you're describing the numbers, when you're telling someone the number of red blood cells, you can tell them either the hemoglobin, and it's represented in terms of a content. So it's grams per deciliter. And this written down here as a normal man has a hemoglobin roughly around 16. Factors that change that, of course, smoking increase it, dehydration increases it. We'll get to that in a minute. Hematocrit is another way of saying how many red blood cells are in your blood, and that's expressed as a percent. So it's a number of cells per volume expressed as a percent. So hematocrit is 45% in this example. A normal man is around 48%, and women are typically lower. So this is just terminology. Red blood cell counts can be referred to as hemoglobin or hematocrit. They give the exact same clinical information. And if all you get is a hemoglobin, you can just multiply by 3, and that's your hematocrit. This is a case presentation of a man in that I took care of in a low resource setting. 60 years old. He had severe pain and infection from a very old gunshot wound that he refused to have treated. And over time, from the gunshot wound, his bone developed osteomyelitis in the proximal end of his femur. When he came, and is a very hot location, he had been transported for many hours. His hemoglobin registered at 7, which is the same as hematocrit of 21. So this guy is severely anemic. The disease of osteomyelitis, just want to show you real quick, it's this chronic bone infection, and the infection eventually finds its way out, but it's chronic, so it never goes away untreated. So it smells terrible, a massive wound. Um, so when he initially comes to the surgical ward, he's getting wound cleaning, intravenous fluids, pain medications, IV antibiotics. And if he looks like he's going to be stable enough, the plan is for surgery. So one day later, his hematocrit drops from 21% to 19.5%. What likely caused his blood count, hematocrit, to drop from 21 to 19 and a half? Was he bleeding, or was he being hydrated from IV fluids? The answer is he's getting IV hydration. So when you see someone that they come in with their hemoglobin levels, you see their hemoglobin levels, think of it in relation to their hydration status always. So hydration increases plasma volume. Remember, plasma is mostly water and soluble proteins. So this is the way I think of it. The numbers are the same. The blue represents the red blood cells. The actual number of red blood cells doesn't change, but the measured value decreases because you're adding all this extra water, in this case, saline. So hydration affects measurements. It doesn't doesn't change the actual numbers. The numbers are the same, but the number of red blood cells are the same, but it only changes your measurements. So it's still the same dog, looks different when water added. Okay, here's a scenario challenge. Have a novice runner. This is very typical among runners. Novice runner running first half marathon, lingers further and further behind. She's drinking water from a Camelback filled with water and stops at every water station. Her pre-race hematocrit is 38%, which is pretty normal for a woman. Okay, so she's overhydrating. What would her hematocrit measure at the end of the race? Would it be higher than 38% or lower than 38%? Correct answer is it's going to measure lower because we've added water. Another scenario challenge. Another typical thing, these very fast runner, professional runners, marathons, they don't take the time to drink. Pre-race hematocrit's 45%. What would his hematocrit measure at the finish line? No change, greater than 45% or less than 45%. So these guys become hemoconcentrated. So again, there's no change in the actual number of red blood cells, but the plasma volume is decreased, so the actual numbers decrease. So these are things to think about when you're taking care of patients in the operating room, recovery room, ER, so that you can decide whether they're bleeding internally or if it's just IV hydration. So basically, we're 60% water, just cucumbers with anxiety. Okay, let's go on to another subject. All right, case presentation. This is a true story from a news article. This is after a heavy snow in New Jersey. The husband put his wife and his 1-year-old child in the car, turned on the car to warm it up, keep them warm. And they're in there while he shovels the snow to get the car out. And when he's done shoveling, he finds that both the mother and child have died of carbon monoxide poisoning. The symptoms of carbon monoxide poisoning, early signs are a headache, shortness of breath, and the late signs are coma and death. So people just kind of get sleepy and then they die. Some of the common causes are the main thing is poorly ventilated homes. In wintertime, people use these little gas propane heaters and close up the windows and doors, and they can get this carbon monoxide poisoning. People that smoke in poorly ventilated areas have actually chronic carbon monoxide poisoning. So people, heavy smokers, will get very high, actually, hematocrits. They'll get high, increased number of red blood cells because they're constantly in a state of hypoxia, actually. Pathophysiology, remember that hemoglobin is in each red blood cell, and it is transporting oxygen. These little iron molecules inside the middle of hemoglobin are what transport the oxygen. And the iron loves oxygen. Sadly, it loves carbon monoxide more. So carbon monoxide displaces oxygen for binding sites. The treatment for carbon monoxide is high flow oxygen therapy to displace back again. Hyperbaric oxygen chambers, if available, will displace the carbon monoxide. Okay, next challenge question. What happens to the pulse oximeter reading with carbon monoxide poisoning? Do you get low readings in pulse oximeter, normal or high readings? The answer is you get normal or high readings. So the typical pulse oximeter can't differentiate between carbon monoxide and oxygen. So a person may be severely starved of oxygen or hypoxemic, and they still may be reading normal levels. So this is an image of, actually this is a cadaver with carbon monoxide poisoning. So it makes the skin look bright, bright red, even though they're severely hypoxic. And this is showing how carbon monoxide is competing for those binding sites. So in carbon monoxide poisoning, there's special co-oximeters that measure carbon monoxide levels. So use that if there's a suspicion of carbon monoxide poisoning. So just to go over a pulse oximeter, what it is, you have to have a pulse. It has to the light has to flash between the sensor and the light. And it picks up the pulse and it reads oxygen as a percent that's bound to hemoglobin. In patients that are very, very cold, they'll have vasoconstriction, and your pulse oximeter may not be able to pick up the arterial pulsations in the fingertips. So this is showing what a pulse oximeter picks up. These are the hemoglobin molecules. If 50% is covered up with oxygen, it reads 50%. And this is 100%, reads 100% of the hemoglobin is bound with oxygen. So case scenario, A man comes to the emergency room, JC, after an automobile accident. There's no obvious bleeding. His vital signs on admission are 120/70. Pulse oximeter is reading 100%. So everything looks okay as far as the vital signs. So 20 minutes later, he's in the ER, and you notice he's starting to look real sleepy. His blood pressure is 75/30, but his pulse oximeter is still reading 100%. Should you be worried if the pulse oximeter is still reading greater than 95%? Yes or no? And the answer is yes. So the pulse oximeter is not measuring the number of red blood cells. It's only measuring how much is being bound to the hemoglobin molecule. So you can have a severely anemic person and still have normal pulse oximeter readings. So the clinical significance of this is hemoglobin or hematocrit can be very low, like 18%, and the pulse oximeter may still read 99%. So you can't tell from a pulse oximeter how severely anemic someone is. So if someone's severely anemic, it increases their risk dramatically for having a heart attack, especially someone with coronary artery disease. And then with normal heart, normal crit, it's not a problem. Okay, so what this says is having anemia or only a few red blood cells, you decrease the amount of oxygen that you can carry to the peripheral tissues. All right, so the main point I want to make with this is don't get into a false sense of security. Pulse oximeters give people a tendency to think everything is fine. And pulse oximeter is not the be all end all. So you need to use your clinical judgment, how the patient's acting, what the other vital signs are. All right, so name the secondary endocrine organ that detects anemia and low oxygen. This organ releases erythropoietin in response to both lungs, intestines, or kidneys. And EPO stands for erythropoietin. The answer, kidneys. Kidneys are incredible organs. They do so much, and we'll be going on when we get to the urinary system, all they can do. But I put all these monitors in there because they can measure both the blood count and they can measure oxygen saturation, and they release erythropoietin if either is low. And the erythropoietin stimulates the bone marrow to increase red blood cell production. Some of it is produced in the liver, but most of it is from the kidneys. So if patients lose their kidneys, you'll see them on EPO therapy. In times past, before there was EPO, patients with renal disease had severe anemia, and sometimes they would need to be transfused. So a patient has severe anemia, and they see nucleated red blood cells on the peripheral blood smear. Should you be concerned? This is a review question. No organelles can be seen on normal red blood cells, or B, peripheral red blood cells do not have organelles. The answer is they do not. They have hemoglobin. They're kamikazes, remember? So in summary, we've talked about gas exchange happening only at the alveolar level. red blood cells, hemoglobin, hematocrit, and then of course oximetry. And this is your summary slide. Remember, ventilation is just breathing. Respiration is the actual gas exchange, either at the alveolar or cellular level. And your oxygen delivery to the peripheral tissues is dependent on oxygen getting to your lungs across the alveoli, functioning red blood cells to carry to the blood cells. And hematocrit and hemoglobin are measurements only, and they're affected, those measurements are affected by dehydration or overhydration. And you can increase your numbers with hormonal stimulation. And then we talked about pulse oximetry uses and the pitfalls. Any questions? Please leave comments. I hope you enjoyed this. Thank you.